Invasive Lobular Carcinoma, ILC. Why is surgery complex? Surgery for invasive lobular carcinoma can be quite challenging. This is mainly due to the unique way this type of cancer grows and spreads. Unlike other breast cancers, ILC often does not form a distinct lump. Instead, it grows in a diffuse pattern, which can make it hard to detect and assess accurately. This growth pattern is partly because of a loss of a protein called E-cadherin, which normally helps cells stick together. As a result, ILC cells can spread in a single fell line through the breast tissue. One major issue with ILC is that it can be difficult to see on standard imaging tests like mammograms and ultrasounds. These tests often miss the subtle signs of ILC, leading to an underestimation of how big the tumor is or how far it has spread. Magnetic resonance imaging, or MRI, is sometimes used for better detection, especially when there are multiple tumors or when the cancer affects both breasts. However, even MRI may not fully capture the extent of the disease, complicating surgical planning. Another challenge is that ILC often grows in a diffuse and multifocal manner. This means that cancer cells can spread widely and irregularly, which can lead to positive surgical margins. This term means that cancer cells may still be present at the edges of the tissue that is removed during surgery. Studies show that up to 65% of patients with ILC may need a second surgery because the first surgery did not completely remove all the cancer. ILC is also more likely than other types of breast cancer to have multiple tumor sites and to affect both breasts. This can complicate decisions about whether to perform a breast-conserving surgery or a mastectomy. Surgeons must carefully evaluate the situation before deciding on the best approach. Another concern is lymph node involvement. ILC has a higher chance of hidden lymph node involvement that may not show up on imaging tests. This uncertainty can complicate decisions about whether to perform a sentinel lymph node biopsy or a more extensive lymph node dissection. Because of its growth pattern, patients with ILC often face higher rates of positive margins after surgery. This can increase the risk of local recurrence, meaning the cancer could come back if any cancerous tissue is left behind. This situation may require more extensive surgery and careful management after the operation. The challenges in defining tumor boundaries also affect the surgical technique used. Surgeons must find a balance between removing enough tissue to ensure clear margins and preserving the appearance and function of the breast. This requires a careful and tailored approach, often involving a team of specialists who can use advanced imaging and surgical techniques. In summary, the complexity of surgery for invasive lobular carcinoma arises from its unique growth patterns, difficulties in imaging, and challenges with lymph node involvement. These factors make it essential for patients to receive personalized care from specialized breast cancer teams. By using advanced techniques and a multidisciplinary approach, healthcare providers can better address the unique challenges posed by this subtype of breast cancer.